Are you looking for a residency? We know it's hard to find a residency during a pandemic. So come on in, let us show you around Bugsy.
Welcome to Baylor University Medical Center. Our residency program offers you an ideal learning environment. Through close mentoring by our engaged and amazing preceptors, you will gain confidence and independence, not only in clinical skills, but in life.
In the emergency department, we have 4 board-certified clinical pharmacists serving as preceptors for our PGY1 and PGY2 pharmacy residents.
My favorite thing about having residents on rotation in the emergency department is helping them determine their goals for the rotation and the residency year, watching them progress from the beginning of rotation in the emergency department and residency to the end of the year, and seeing them succeed once they graduate our residency program.
During your rotation in the emergency department, we focus on the pharmacotherapy of emergent disease states by getting the resident bedside to provide hands-on care, enhance their critical thinking skills, and understand how the workflow of the emergency department feeds into the rest of the hospital. Most patients in the hospital come through the ED, so no matter which specialty they end up on, you're sure to see a wide variety of disease states while you're here.
We love having ED pharmacists down here. They are literal lifesavers. I can't tell you the number of times that I have come to them for their expert knowledge to know more about how to take care of my patients, particularly when there are drug interactions or critical medications that I don't have that same level of knowledge.
The best part of my job in the ER is being a part of an interdisciplinary team. Our ER pharmacy group covers 24 hours during the weekdays and then 12 hours on the weekends in the ER. We cover everything from your code strokes, your cardiac arrest, all the way up to helping care for our psych patients that are holding over in the ER, to prescription callbacks to counseling patients that are being discharged. We get to work with a phenomenal group of physicians and nurses, and it's truly the best part of working at Baylor.
Pharmacy is an integral part of our program. They are present at all of our major resuscitations, and they help us provide evidence-based care for our patients. I don't know what we would do without them.
Yeah, they are an awesome part of the team. Anytime there's a sick patient, they're always here to help us out and really keep things moving smoothly with all of our farm needs. They're awesome.
Baylor University Medical Center's critical care services are split into 5 ICUs with over 100 beds. Units include the medical ICU, surgical ICU, cardiothoracic ICU, neuro ICU, and bone marrow transplant unit. We are also a Level 1 trauma center, comprehensive stroke center, and an ECMO center of excellence. Our board-certified preceptors are highly involved in multidisciplinary rounds, critical projects, committees, and research. With this patient acuity and variety, Baylor University Medical Center offers a great training environment for PGY1 and PGY2 pharmacy residents.
Pharmacists on the internal medicine service line practice in a hybrid practice model, managing both clinical and distributed functions. This empowers us to take ownership of our patient outcomes on the area that we serve. During the residency year, the residents are really intertwined with our internal medicine and CV team because they go through orientation training with us, work with us on several projects throughout the year, and also work with us during the weekend staffing component.
One unique thing about internal medicine for the residents is that they actually get to do 2 different rotations with us. Their first rotation is Medicine 1, where they are learning the foundations of internal medicine and rounding with the preceptor on the unit. And then later in the year, they'll come back and do Medicine 2, which is a much more independent rotation where they're actually rounding with the teaching team and the medical residents.
The internal medicine rotation is the first rotation you'll do. It's really part of the training and orientation process. It's really about getting used to things, about getting used to be a pharmacist, really. So we spend time in learning how our electronic health record works, how to get used to looking at patients, how to interact with the team, with all the providers, doctors, nurses, etc., and how to just get incorporated into the department.
Welcome to Baylor!
We are the Transplant Pharmacy team. My name is Tina.
My name is Raksha.
I'm Nicole. We are the socially distanced team.
We split our time between the inpatient heart, lung, and abdominal teams, and we have plans to soon expand into clinic space.
The Transplant Center at Baylor University Medical Center has performed almost 10,000 solid organ transplants. In 2019, we performed 174 kidneys, 102 livers, 9 pancreas, 58 heart, and 33 lung transplants. We have become a pioneer in uterine transplants, having completed 20 transplants with 10 deliveries to date.
We are globally recognized for our contribution to transplant research and have a dedicated research team for each organ, including transplant biostatisticians that the pharmacy resident can work closely with on their research projects. The program has become a part of many pre- and post-transplant trials, from data in mTORs, hepatitis C, LVADs, and much more.
Every resident that rotates their transplant has the opportunity to customize their rotation to fit their interests and experiences, regardless of whether they're interested in a transplant PGY2. We have had residents interested in cardiology, and we've created cardiology experiences for them, gotten them to love devices and heart failure, created outpatient experiences for those who are interested in ambulatory care, organized time in the immunology lab, as well as create a transplant infectious disease rotation. Our transplant teams rave about our residents and really view them as an extension of the transplant pharmacy team.
Pharmacy is fully integrated in the transplant services here at Baylor Dallas and at Baylor Fort Worth. We enjoy the presence of the pharmacist during rounds and in the ICU, on the floor, and now also in the clinic. They are an integral part of our activity. They participate not only in patient care and planning, but also in the new protocol of the immunosuppression medication that every 2 years is proposed by us and is decided in a multidisciplinary fashion. Camaraderie between pharmacy and transplant surgery. We value their opinion and their suggestion on every single patient, from immunosuppressive therapy to antibiotic therapy, even to diagnostic when needed. So there is really no possibility of taking care of our patients in the way we can today without the support of pharmacy.
The Pickens Cancer Hospital at Bumpsey is the first all-oncology dedicated hospital in North Texas. Approximately 150,000 patients are treated at our hospital each year. The building has 116 beds for oncology patients, which include an outpatient emergency treatment center, which is an ED specifically for our patients, an ambulatory infusion clinic, an apheresis unit, a post-surgery unit, 2 floors for med-onc and hem-onc patients, and a floor dedicated to bone marrow transplants, CAR T-cell therapies, and 6 ICU beds. Our cancer program at Bumpsey is focused on delivering safe, compassionate, quality patient care.
Oncology is one of the fastest growing fields, with 48 novel oncology agents being approved in 2019 alone. Here at Bumpsey, we have developed a PGY2 oncology pharmacy residency to prepare residents to work in a diverse setting in this expanding world.
Our goal is to prepare our residents to be well-rounded clinicians who can provide optimal care to patients in any environment. We provide a variety of learning experiences, including medication management, development of guidelines and protocols, teaching, and research. The structure and learning experiences are also customized to meet each resident's professional and personal goals.
Our role as oncology pharmacists doesn't stop with the daily patient care responsibilities. We are heavily involved in development of oncology treatment protocols, algorithms, guideline procedures, and patient safety measures. We have been an integral part of our EHR implementation in 2019 and have an ongoing participation.
It is the uniqueness and diversity of our pharmacists and pharmacy staff that allows us to provide a well-rounded experience for all of our residents, not only in the PGY2 settings, but also in our PGY1 residencies. For that, this program will afford you very many unique and wonderful opportunities to prepare you to become the practitioner that you desire to be in any setting, whether inpatient or outpatient.
I chose BUMC for the opportunity to care for critically ill patients at one of the best hospitals in Texas.
I chose BUMC because of the people, the environment of this place, and the culture of everything about BUMC.
I chose BUMC for the wonderful preceptors and the variety of learning opportunities here.
I chose BUMC for the diverse patient population, the preceptors that are excited about teaching, and the incredible environment here.
The favorite part of my residency at Baylor University Medical Center was definitely the people. Residency is challenging and pushes you to the edge of your abilities, so having a good support crew around you is essential. The preceptors, the staff, and the pharmacy management team were all phenomenal. I enjoyed them so much that I stayed on afterwards, and here I am 5 years later, still working side by side with them.
I've only been within Baylor Scott and White since I graduated from my residency, and it's helped me move up in different positions every 2 to 3 years. Started out as a pharmacist, and then I moved into a clinical coordinator role, and then a director, and finally a corporate director.
And I also developed a really amazing bond with my residency class and got a lot of incredible mentors out of it as well. Kirk Starr, Tina Sam, Jennifer Roth, to name a few. And so I'm very proud to have completed my PGY1 at BUMC, and I look forward to any resident that gets to complete their PGY1 at BUMC, as it's truly a great place.
My experience as a BUMC pharmacy resident was unforgettable. I remember intense situations, on-call incidences, unforgettable events, drug shortages, natural disasters, all sorts of other debacles. Despite this, I wanted to stay forever at every clinical rotation site I was assigned, mostly because of the people.
It all started as a PGY1 resident at BUMC. I have been truly shaped by the various talented preceptors, and I think that is one of the strengths of being a resident at BUMC.
Welcome to Baylor.
We hope to see you soon.
That's a cut. This is a great place to be because the waffle fries came back and I can actually eat lunch tonight.
Gotta back up. Reset. Are we gonna have a bloopers reel?
Sure. Is that good?
Yep. Yeah. I don't know what else we do.
All the way up until like
and all the yes.
Counseling patients.
Okay. We split our time. Sorry. Okay. Well, we can practice.
Yeah, exactly. Just continue. Yeah, exactly.